Sweetened breakfast cereals are often perceived as a quick and convenient way to start the day, but for individuals with diabetes, they are a hidden and potent threat. Marketed as healthy or fortified, these cereals frequently contain shockingly high amounts of sugar, often comparable to candy, combined with refined grains that are rapidly digested. Consuming such cereals in the morning can produce an immediate and pronounced spike in blood glucose, setting the tone for unstable glycemic control throughout the day. For diabetics, these spikes are particularly harmful because the body is already vulnerable after the overnight fast, and an abrupt glucose surge can overwhelm insulin response, whether naturally produced or injected. The refined grains in most sweetened cereals exacerbate the problem. Stripped of fiber, protein, and essential nutrients, these grains are absorbed extremely quickly, leading to sharp increases in blood sugar. Unlike whole grain options that release glucose gradually, sweetened cereals function essentially as concentrated sugar in a bowl. Even seemingly small servings can contain 20 to 30 grams of sugar, which is sufficient to produce a significant postprandial spike. For type 2 diabetics, this contributes to worsening insulin resistance over time, while type 1 diabetics face unpredictable glucose elevations that complicate insulin dosing and increase the risk of hyperglycemia. The added sugar content is particularly insidious because it is often disguised in ingredient lists under names like corn syrup, cane sugar, or maltodextrin. Many individuals assume cereals are a light or healthy breakfast choice, unaware that a single serving may contain more sugar than a candy bar. This hidden sugar creates a silent assault on blood sugar regulation, undermining careful dietary planning and contributing to cumulative hyperglycemia. Regular consumption of these cereals can accelerate microvascular complications, including neuropathy, retinopathy, and nephropathy, as well as heighten cardiovascular risk through sustained inflammation and endothelial damage. Sweetened breakfast cereals also contribute to obesity and metabolic stress. High sugar intake stimulates cravings and reinforces habitual consumption patterns, making it difficult to resist additional sugary foods throughout the day. Combined with low satiety from refined grains, this often leads to overeating, weight gain, and increased visceral fat accumulation, factors strongly linked to worsening insulin resistance and accelerated diabetes progression. Over time, these effects can create a vicious cycle where dietary choices undermine metabolic stability, necessitating higher doses of medication or insulin and increasing long-term health risks. Even cereals marketed as low-fat or fortified are not safe for diabetics if they are sweetened. While added vitamins and minerals may be present, they do not offset the metabolic damage caused by concentrated sugar and refined starch. The body experiences the full negative impact of these foods, including blood sugar instability, increased insulin demand, weight gain, and accelerated vascular and organ damage. Psychological factors also reinforce the risk. The sweetness triggers dopamine release in the brain, promoting repeated consumption and establishing a pattern of dependency on sugary breakfasts that can persist for years. In summary, sweetened breakfast cereals are far from benign. They deliver concentrated sugar and refined carbohydrates that spike morning glucose, increase insulin resistance, contribute to weight gain, and accelerate long-term diabetes complications. For individuals managing diabetes, these cereals are not simply an unhealthy choice. They are a daily threat to metabolic stability. The brief pleasure of taste comes at the cost of significant and lasting harm, making avoidance essential for preserving blood sugar control, preventing complications, and protecting long-term health. Each morning consumed with these cereals is a missed opportunity to start the day in a metabolically safe and controlled way.